said, acupuncture is pretty much good to treat a lot of things, and we're going to go on to find quacks in other areas, and gave up. Anyway, so kind of a fun story. Yeah. Yeah. The pulses, yeah, it's a pulse diagnostic system we use. Absolutely. Yeah, yeah. I'll go back to the picture. There it is. That's someone's not good looking tongue. And then this is the, so basically what they discovered is there's a map here. Unfortunately it's not too readable with it going up to this side, but large intestine, small intestine, kidney, bladder, stomach, spleen, liver, gallbladder, lungs, and heart. And it shows exactly how well the body's doing in those individual areas. I'll give you an example. But there's several things we look for. If you want, you can jot this down. It's interesting info, probably. You look for the color of the tongue itself, the coat, the size, and the shape. So, for example, a person could have a color that's abnormal in the tip of their tongue, which is very red. When you go home, you can look in the mirror, have your significant other look at your tongue or something like that. And you go ahead and put your tongue out, you look at it, and there may be like a red color, which would show that there's a little bit, in words of medicine, we would call like a heat that's trapped in the heart, oftentimes caused by emotional stress and duress over time. The heart is the king of emotions, and so people can experience stress, and then that generates heat and inflammation and stuff like that. As an example. Yeah.
Is there like a recommended diet and stuff, kind of like how Ayurvedic has the doshas and all that kind of thing? Is there something similar?
Yeah, let's take a peek. So, interestingly enough, there's some info in the book. Oddly enough.
And I'm not a plant.
No, she's a human. She's not a plant. She's not. Yeah. Anyway, so page 13. The 5 main branches of Oriental medicine. The second branch is Oriental nutrition, which encourages the use of certain foods that are dependent on the individual's body type and the season.
Wow.
Yeah, very cool. If you want, you can go to the website. It's MilwaukeeAcu.com. Go to the newsletter section, I believe, and open up the one that says Oriental Nutrition. I'm going to jot that down. You can check that out online, and there's a whole kind of, like a newsletter on that particular topic. So Milwaukee Acu, ACU, Acu.com, and then you just go ahead, click on the newsletter section, and then open up the one that says Oriental Nutrition, and it talks about in Chinese medicine again, as discussed in the book, the 5 elements. Just so everybody's clear, there's this concept of the tridosha, which was originated in India by Ayurvedic practitioners, doctors of the original form of medicine in India. And there's 3 categories of people, and then people have these 3 categories internally, and they might be in balance or out of balance. And the 5 elements work the same way. It's just 5 rather than 3, but there's a lot of overlap there. I have friends who are Ayurvedic practitioners. So. Isn't it? Yeah, 5 elements are awesome, and tridosha is awesome. Yeah, good. Right.
Getting back to the tongue, is my understanding that any of those sections that say the stomach or the liver is that if that section is red, that particular section, then that's a problem?
Well,
or how does that work? How would you know by looking and see it?
Well, there's 4 qualities that we look for in the tongue. You have the color, the coat, the shape, and the size. So those are the 4 things we're really looking for, right? So the color red isn't necessarily bad, but someone could have a bright red color. I should have clarified that. The tongue should be a nice normal red. It shouldn't be purple or pale or pink or green or orange or bright red or scarlet. If you had a really bright red tip or you had a scarlet tip, that would show that something's happening with heart function. And there could be many things that would, we kind of put it all together to figure out what it is that's causing it.
So I guess when those sections that you have designated on there as the liver, is it just that section would have a specific color, or is it the whole tongue? I mean,
it could be a
I
lot
guess
of
what I'm
things.
asking is how would you know, what is the determination if it's the liver, gallbladder versus the stomach, spleen, or whatever?
Well, it's the location of whatever we see. Like if, you know, I've had people come in and there's like incredible cracking in here, and that would show something happening there, and it shows namely that that person's body is being attacked by like a medication or stress or dietary factors, and those systems are breaking down. Whereas in this area, it could, like we oftentimes, we don't see cracks this way usually, but they usually go this way and they're kind of weirder. You get scallops, you know, like it looks like tooth marks. Yeah, which, oh, okay. What's that? Well, it could, and there's several different things that could cause scallops. As an example, we can speak freely. I mean, we're kind of like bearing our souls here if I start to get into this. We could talk another time. Oh, okay, all right. So, y'all are going to be knowing, you know, Jane's diagnosis here very shortly. Anyway, so depending on where the scallops exist, they could indicate several things, right? So let's say that there were only ridges or scallops or what are known as tooth marks in this area. It usually indicates that there's a breakdown in liver function in some way, shape, or form. There's a more universal scalloping that we'll see as acupuncturists where the tongue is actually swollen and there's inflammation. And the reason for that is that the body isn't, the body's pretty smart. Let's just say that to start with. It's like very smart. It's always trying to protect the most vital systems as long as it's functioning at a high level. There's times that it forgets to do that and then things get really haywire and that's when it gets super complicated. But there's these fluids that are supposed to just move through the body in specific ways. Everything's going fine. If you have a loss of function, going back to our original discussion of the lungs, the spleen and pancreas, and or the kidney and adrenal, fluids can go amok, so to speak. And they'll go in the wrong direction to the wrong place to do the wrong thing. And then when they overflow in the body doesn't know what to do with them, and it protects the vital organ systems by putting the fluids in places